if we can look at the individual. So if we saw, just to take an example of someone with a disc bulge, posterior lateral on the left-hand side with a focal distribution. Now that sounds like a bunch of mumbo-jumbo, but we've created enough of those to know that that person was flexing forward and bending to the right repetitively over and over again. And we also know a lot about the shape of their discs, which there's quite a variety in the population as well. So again, if someone comes in with a very specific type of pain and we can replicate that, we can get at what the cause is quite precisely. But generally, it's people who have repetitive movement patterns that are non-optimal for their body and their injury history.
Yeah.
What they do, if they're training and working out, what they do for the other 23 hours very much should determine the components of their exercise program and whether it's appropriate or inappropriate. So it really is the full gamut. And just to let your listenership know, Chris, when I see a patient, it takes me about 3 hours to perform a thorough assessment and come up with advice on what they should not do and what they should do.
Sure. So just going back to sort of the start of the answer, when you were talking about the disc bulge, it's kind of turning up on the opposite side of the disc as to where they're bending. If that makes, is that sort of an easier way to just describe it, or am I?
No, you're exactly right, Chris. If you take an orange seed and you squeeze it between your thumb and your finger, you can direct that orange seed to squirt out the left side of your pinch grip or the right side. It depends on how you bias the force. So it's hydraulically driven. So the nucleus of the disc, which is a gel, if you keep flexing forward, it pushes and squeezes that hydraulic fluid, if you want to consider it such. It's going to, through hydraulic stresses of bending forward, push it out the back. Then the collagen, which makes up the rings of the annulus, it will destruct and delaminate at the site of highest stress. I mean, that makes perfect sense. So you can then reconstruct what the stresses were looking at the nature of the damage. Now, in order to get to that level, you would have to have a medical image like an MR or a CT. But without that, certainly you could replicate those postures and movements. And you've seen my assessment DVD on some of the mechanical-based assessment exercises, very specifically probing different postures and loads to really isolate what that specific damage is causing in terms of specific pain. Yeah.
So I guess a sort of a very simple solution for maybe just general people who experience their back pain, an easy way for them to not so much overcome it, but at least sort of ease it or reduce it, is to maybe identify the postures that they're creating pain in, and sort of come out of those postures and stay in sort of I would call like a neutral posture. Would that make sense?
It might be a neutral posture. It may not be, but let's if we replace that term with the resilient posture.
Right, I see.
Now that resilient posture, that might change, and it will change throughout the day, and it changes depending on the loading history for the day. For example, if I asked you to get up in the morning, touch your toes, and then go out kayaking in a canoe, I suspect that your resilience to that would depend on if you did something else first. Do you see what I mean?
Yeah.
Oh, right, okay. So it's simple, but it's complicated.
Yeah, sure. Yeah. That seems to be a general sort of theme that goes on through my learning. So, but yeah, no, it's all good. So, sort of moving on from there. So we've got these people who have sort of a cause of back pain, depending on how they're assessed and how it's found out. Now, I've heard you talk about sort of how back pain occurs. And again, what I come up against in the classroom when I'm up teaching, and also when I'm one-to-one coaching with people, is they'll say, I was picking up a pen, I was lifting something light off the floor, I was bending across my desk or something like that. They'll say, and then my back went. And obviously